Well, starting your career is often exciting, but some interns and health workers who are doing community service are now finding themselves on the front line in the battle against COVID-19. Many have just a few weeks' experience, so how are they coping then? eNCA's Mobile Madlala spent time at the Heidelberg Hospital here in Gauteng to find out.
Like soldiers in a war, the community service doctors, or ComServe as they're known, as well as interns, are now in the thick of it. Entering the medical fraternity right now is rather different from what it would be if it wasn't for COVID-19. New and experienced health workers are dealing with critically ill and dying patients.
In the health system or a health professional, most of the time is a calling, you know. So even if you're scared, you know that you are needed and you have to show up time and time again. Most of the time we miss our families, we can't see them as much as we can. Some of us have young kids, you know, but I guess it's the new normal, video calling, social distancing, only seeing them once every few months.
It's quite overwhelming. The deaths that I've experienced, although I will not reveal the number, they're quite, I can say, traumatizing emotionally, seeing people die and seeing people suffer from COVID, especially because I'm from school and we were not exposed that much, especially with the first wave. Now there is the second wave, I'm here and I'm seeing a lot of things. It is quite a lot to take in.
I'll do critical thinking at that time. You would do whatever that would make a patient safe at that time. I won't say this is the way how you should do what treatment you should. You'd act according to the patient's presentations.
The Level 1 Heidelberg Hospital says it learned lessons from the first wave of the pandemic in South Africa.
We then repurposed 4 of the 44 beds and we had made them critical beds, which means we have added, we've had ventilators and ICU beds, and we've got staff that has been trained to make sure that they are able to look after patients in case of need.
The ComServe health workers and interns have simply had to learn to adapt, despite feeling overwhelmed at times, but nonetheless, they are eager to serve. Mobile Madlala, Heidelberg in Gauteng.